Dorsum pedis. The back of the foot has a number of bony and tendinous landmarks. The tuberosity of the navicular bone is prominent on its medial aspect and can be palpated at the midpoint between the calcaneal tuberosity and the base of the first finger. The head of the talus can be identified between the tuberosity and the medial malleolus. The base of the first metatarsal bone is located 3 cm distal to the tarsal head, and the metatarsal head is located further distally. Immediately anterior to the lateral malleolus, there is a depression corresponding to sinus tarsi. The tuberosity of the 5th metatarsal is clearly visible around the middle of the lateral margin of the foot. The skin is thin and movable. The superficial fascia is also rather thin and is comprised of loose connective tissue. It contains the venous network, dorsal venous network of the foot, among which there is a bigger vein called the dorsal venous arch of the foot. This vein gives rise to 2 saphenous veins, vena saphena magna forms medially and ascends anteriorly to the medial malleolus. Vena saphena parva forms laterally and passes inferiorly and posteriorly to the lateral malleolus. Terminal branches of the saphenous nerve reach the proximal part of this region. Sensory innervation is accompanied by the medial dorsal cutaneous nerve and intermediate dorsal cutaneous nerve. These emerge at the border between the leg and the foot as a result of the division of the superficial peroneal nerve. The lateral dorsal cutaneous nerve is a direct continuation of the sural nerve along the lateral margin of the foot. These nerves give rise to the dorsal digital nerves, which innervate the back of the foot and the digits. The terminal portion of the deep peroneal nerve emerges in the first intermetatarsal space. It splits into 2 branches on opposite sides of the first and second digits. The proper fascia of this region, fascia dorsalis pedis, is continuous with the fascia cruris. In the proximal part of the region, the fascia thickens into a fibrous band, the inferior extensor retinaculum of the foot. Medially, the retinaculum splits to form a superior and inferior band. It sends fibrous septum to the bone, resulting in the formation of osteofibrous canals. The medial canal transmits the tendon of anterior tibialis muscle. The intermediate canal transmits the tendon of extensor hallucis longus muscle, and the lateral canal contains the tendon of extensor digitorum longus muscle. The subfascial space contains muscles, nerves, and vessels. The muscles are arranged into superficial and deep layer. The superficial layer contains the tendons of the long extensors of the digits, while the deep layer contains the short extensors. The nerve vascular bundle is composed of dorsal pedis artery and vein, and deep peroneal nerve. At the level of the talocrural joint, the nerve vascular bundle lies on the articular capsule between the tendons of tibialis anterior muscle and extensor hallucis longus muscle. On the dorsum of the foot, the nerve vascular bundle crosses the inferior aspect of the extensor hallucis longus muscle, where the tendon of extensor hallucis brevis muscle. Its course projects along a line continuing the midpoint of the anterior bimalleolar line and first interdigital space. The dorsal pedis artery pulse can be felt along the line as the artery runs immediately over the tarsal bone. The dorsal pedis artery gives off the medial tarsal arteries and lateral tarsal arteries and arcuate artery. In the first intermetatarsal space, it divides into the terminal branches. the first dorsal metatarsal artery and deep plantar artery. The latter pierces the interosseous muscles and proceeds to the sole of the foot. Arcuate artery runs along the base of the metatarsal bone, giving rise to the dorsal metatarsal arteries. The deep peroneal nerve runs along the medial aspect of the artery, providing branches to the short extensors of the digits. Then it continues through the first intermetatarsal space and moves to the subcutaneous layer.